Thank you, Bart. Angie and Joe, you came into HODS a little later, a couple of years later. What's the story behind it? What's the motivating factor that helped you get into HODS? Help you decide?
I'm going to start because she can elaborate on it. We came into HODS in 2017. The one thing I can say off of what Bart said, we have a little different kind of approach. Like our approach has been more marketing to the community. And so we feel like physical therapy can be the entry point to the healthcare system rather than having a physician be the entry to the healthcare system if you have an injury or breakdown musculoskeletally. So this was a great platform for us to bring into our, practice in that. So I feel like that's what really got us going. And, like I said, she can elaborate more, but I feel like that's what got us into it.
Yeah. 2017, we came into the program. Actually, we were, it was after Hurricane Irma when our practice took quite a blow and, things were crazy. And we re-looked at kind of our vision as to how we were going to forge ahead. And one of the things we looked back to was Vision 2020 and the autonomous practitioner, as well as our direct to community marketing. So, it was at that point that we said, well, if that's what we're going to do, we better be able to diagnose these people very, very well. And if we're that entry point, be very accurate in what we're treating and how we're treating it, and or be able to make a solid referral to our orthopedic friends or neurology friends or whomever, that might be. So that was really our vision and our purpose on coming into HODS.
Thank you. I want to ask you guys, I'm asking you first, Joe, actually, because from the couple of you, Joe has been more the clinical guy and Angie has been more the business guy, meaning Angie has been the boss and Joe has been the guy who works. Okay, so I want to ask you, give us a little bit about your educational experience, and then give us an actual patient example that shows the difference that diagnostics made in your patient treatment, essentially, and patient management.
Absolutely. And being in the program, I can see there's different entry points. So we have some people that come into the program that are fresh out of school. That's an advantage as far as like when you're talking like the actual anatomy, and all that. Where for me, I have all the patient experience. So that part was easy for me, but then I had to relearn back to the neuroanatomy and all that. I feel like there's no really advantage in any point, so you can come in at any level. It's funny, though, going back to what you just said as far as an example, because I'm still working on some of our new hires who are not generating the referrals and, as far as our internal referrals, patients who should be tested and they're not. And one patient that really sticks out for me is a patient that we had a doctor of physical therapy, fresh out of school, did an amazing evaluation. I did the actual review on the patient. So the patient was referred for a rotator cuff tear. MRI showed positive for rotator cuff tear. Evaluation was done, and all of the evals showed actually rotator cuff. Everything led to that. Patient was seen for 6 weeks, no improvement. Range of motion hardly improved, no improvement in strength. We were actually new earlier into the HODS program at that time, so we said, let's go ahead and do an EMG and let's see what we got. And actually did the EMG and found out and MSK. MSK did confirm there's a rotator cuff tear, but it was minimal to moderate. But the EMG actually showed a moderate to severe C5, C6 axonal injury. And at that point, we're like, whoa, this has been, and then going back, the patient never had neck pain. Patient never, nothing showed anything related to the neck. But now we knew something. So we started treating that, and that patient, I mean, his improvement was through the roof then from the next, month after that. But actually, all of us were kind of blown away at that point, knowing that, holy cow, like, because we were going by, the doctor first, which we always, hey, the doctor must know. The MRI confirmed it. Yeah, it was shown. We did an MSKUS, it showed it.
Special tests.
They're all, positive for.
Clinically looked like a rotator cuff. Yeah.
And then boom. And sure enough, he went to see a neurologist or neurosurgeon. Neurosurgeon said, actually, it was self-fused at that level. Couldn't even do anything, but we were able to at least address it at that level. And he showed, moderate, improvement from that point. So.
And this is amazing because actually then you can create a treatment plan that is really customized to that patient and addresses this issue